You're watching the Eagles Heart and Cancer Telethon. My name is Dan Moris, and here in this first hour of the telethon, we are joined by Crossing Rivers Health. They've been a regular sponsor of the first hour of the telethon, and we're so very happy to have representatives from Crossing Rivers Health back with us here this year. Although virtually, we're very glad to have you. I'll introduce Chief Development Officer Sasha. Thank you for joining us. And also Christopher Brophy. He is the Chief Executive Officer at Crossing Rivers Health. Hello, Chris. How are you doing?
I'm great. How are you, Dan?
Chris, I think this is your first appearance on the telethon, correct?
It is. And, in true 2022 fashion, we're doing it via Zoom. So I'm glad to be here and, glad to be on the telethon. And
I think, this will be a nice, dip your toes into the water. And then next year, hopefully, we'll have everybody here in person and look forward to have you there. Sasha, you've been coming to the telethon for years, so it's good to have you back as well.
Yes, thank you. Good to be back.
All right, let's start off with, I know every year it's really important for the telethon. We like to see checks come in, and Crossing Rivers Health does play a big role in some of the money coming in. So I'm guessing there's something you'd like to share with us? Wonderful.
Yes, we are happy to sponsor the Eagles Heart and Cancer Telethon again this year at the amount of $500.
Wonderful. Awesome. Thank you so much. We appreciate it, and a big part of kicking off our fundraising efforts here tonight. Thank you from everybody here at the Heart and Cancer Telethon. Chris, let's talk about Crossing Rivers Health. What's new? What's happening? What can you share with us about what's happening here at the hospital?
Yeah, there's a tremendous amount happening at the hospital. When I look back at 2021, another pretty challenging year. Had to persevere through a lot of things. The organization ultimately had a banner year in 2021. Tremendous amount of high quality care provided close to home. I mean, that's really what we're here for. We're here to support the communities and, really, look to provide that care close to home. We had some growth in our orthopedics team. We've, continued the collaboration with Gunderson to provide cancer care close to home, oncology and chemotherapy close to home. That's obviously near and dear to many people's hearts. We've exceeded many of our organizational goals, most importantly, the quality and service perception. It was an extraordinary year, very taxing and challenging year, but an extraordinary one for Crossing Rivers Health for sure. One of the things that we look forward to is some real exciting projects into the future. 2022 is going to be another challenging year, but hopefully for different reasons. And we're looking forward to following through on some of the original plans of this facility and undertaking a clinic expansion, adding on to our facility. We're going to also look at integrating behavioral health services into that primary care setting, expanding those services and continuing to support specialties close to home. So a lot of exciting things coming.
Yeah, that clinic expansion is going to be a really big deal. Go into some detail on that. What's that going to look like when that comes to fruition?
Yeah, it's been a lot of planning, but like many people know, you measure twice and cut once. But what we're looking to do is on the north end of the facility, we're looking to add about 17,000 square feet, and that'll house our primary care clinic as well as behavioral health. And it's going to have a pretty exciting kickoff. So you may have to stay tuned to see what it looks like, and we'll be kicking that off as soon as we can. Groundbreaking for that is expected to be in the spring.
You mentioned behavioral health and the integration in with the clinic. Talk about what that means for the patients and how that integration is really going to help really increase the level of care, the quality of care, and the continuity between the two worlds.
Yeah, you hit on it. Very, very well there. Integrating behavioral health services into primary care not only offers some great resources for the providers that are there, but also for the continuum of care for the patients. When patients come in and they may have something that they want to discuss, really investing in that integrated model means that there'll be access to behavioral health care in a different way. And that's something that, we'll expound upon more, but, it's an exciting time and a continued commitment to one of the things that really stands out on the community health needs assessment. And, we're really going to put some very significant effort forward to try and address those things.
Of course, here at the Heart and Cancer Telethon, we're raising money for heart and cancer research. Many people, or at least someone in your family has been affected by heart disease or cancer. And a big part of that to stay healthy is prevention and also testing and screening. And Sasha, I'll go to you with this one. I know that in the month of February, Crossing Rivers Health is helping to promote the Flannel Check Challenge to encourage and remind people to make sure that they're staying up on those screenings, to catch something early, or to make sure that you are in the best health possible to prevent some of these diseases.
That's right. So as you mentioned, Dan, in February, to heighten awareness of prevalent diseases which impact the residents of our communities that we serve, we are inviting everyone to join the Flannel Check Challenge. Many illnesses, as you know, have colors which represent the disease, breast cancer being pink, very well known, prostate cancer, blue, melanoma and mental illness, black, heart disease is red, and so on. So we've chosen to join the Flannel Check effort. Flannel represents many diseases in one colorful pattern. Chris and I are wearing flannel today just to kind of show our support. And we're encouraging everyone to, just take action. Be aware of what diseases may potentially be prevalent in your family. Be aware of changes in your health, etc. And a good way to do that is to schedule your wellness exam and then go through with screenings as kind of advised by your provider. Raising awareness throughout the month of February for the prevalent diseases and any disease that might, have impacted you or your loved ones. We're joining together on February 10th, so that's a Thursday, for National Flannel Day. And we're just encouraging everyone to get together, wear flannel, talk about those diseases, and again, take action, schedule your screenings, encourage the people that you love to do the same. And join us on February 10th. You can join us by posting a selfie wearing flannel. Get your school group together, your work group, your family, anyone that you'd like. Join us in drawing awareness of all of those diseases that we can prevent and detect early. Early detection saves lives. So let's really get out there and take action and use Flannel Day on February 10th as a way to do that.
Let's talk about something Chris alluded to a little bit earlier, and that's the community health needs assessment. Some results in from that. That survey helps give us an idea of what direction to go with the healthcare services provided here in the area. What are some of the findings from that, and where do you see that leading?
Yes, so just a little bit about the community health needs assessment. I know that we did receive great response from our community members, from stakeholders, from the general public. And we just go through on a triannual basis and take a look at data that's available to us. We gather, the perceptions and the voice of the community through surveys, through focus groups, and then we take all that information and really narrow in on what are the needs of our communities and how can we best address those needs. Is that directly through services that we can grow and expand, just like Chris mentioned, expanding access and, doing that for our primary care and also behavioral health services. That is one thing that we had heard through the community health needs assessment, that we need more access, more behavioral health providers within our communities, more access to specialty services. But we've heard a number of things this assessment process, and we have published the findings of that assessment on our website. It is crossingrivers.org/CHNA for Community Health Needs Assessment. And folks can just take a look at just the large variety of items that we've uncovered, and they're going to be, yes, behaviors and socioeconomic factors that are uncovered, and all of that plays into our overall well-being. So, we would look to obviously work as best we can to address those needs. And like I said, whether that's on our own or in collaborating with partners that we have throughout our service area, Aging and Disability Resource Center, the UW Extension, of course, our Crawford County and Grant County Public Health Departments are great partners. And we look at, partnering with others, all with the main idea of addressing those needs as best we possibly can for our communities.
Let's touch on screenings one more time. We mentioned a little bit with the Flannel check promotion that's going on during the month of February. Lots of different options as far as screenings available here at Crossing River South. If you want to run down some of those options for people in the area.
Sure. Of course, we have through primary care services, we have skin cancer screenings or skin checks. We've offered those periodically throughout the year, but anytime that someone has a wellness visit, they're open to share those concerns or have a skin check. Thyroid testing, prostate screening. Of course, we have our awesome medical imaging department. We have 3D mammography, bone density screenings, cardiac CT, colonoscopies, of course, as well. So really, again, just having that frank conversation with your primary care provider and talking about what your family has had as far as health concerns and what concerns you might need to just be aware of. So again, early detection saves lives, and there are preventative ways that you can stay on top of those things and really take care of your overall health.
And so many of those things available right here close to home at Crossing River South, and that's the cool thing, right?
That's cool. Yep, that's what we're here for.
All right, and Chris, let's wrap it up with you. Some final thoughts before we let you go.
Yeah, I just want to express, a sincere thank you and a great appreciation for the work that the Eagles Telethon does, not just for heart and cancer research, but how it really bands the community together. This has been an event that's gone on for many years, and this may be my first time doing this, but the technological advancements and the donations that come from this and the attention that it brings to some of the things that may be preventable. It improves outcomes. When, as Sasha mentioned, the screenings, awareness and prevention, all the way through treatment and rehabilitation. I mean, that's what care close to home is about. And it doesn't matter what stage it is or anything like that. It's, how do we provide care for our communities? And, the Eagles has done a great job helping support that. And we're glad to be partners and look forward to a happy and healthy 2022.
All right, Chris Brophy, Chief Executive Officer, Sasha Dahl, Chief Development Officer, joining us via Zoom for the Eagles Heart and Cancer Telethon. We hope to be all in person next year. But thanks so much for the time. Sasha, hold that check up one more time. Let's see it. If you got it around. There it is. Thank you so much to Crossing River South, and keep watching the Eagles Heart and Cancer Telethon.
Thank you.